The first sign is Braxton Hicks. Braxton Hicks, also known as practice contractions, tends to intensify as labor approaches. In order to determine if you are experiencing Braxton Hicks contractions and not labor contractions, try to empty your bladder and drink a glass of water before you lie down. As your baby develops full term and is preparing to go out of your womb, your baby begins his approach to the outside world by descending lower into your pelvis. This causes an increased heaviness or pressure in your pelvis and may prompt you to urinate more frequently. You may also find removing your bowels quite difficult. You may also experience swelling in your legs and feet. Several weeks before actual labor commences, your cervix will begin to thin out and soften as it begins to pave the way for the coming out of your baby. Dilation is one of the most important signs of labor. As the cervix softens and dilates, some women will experience an increase in mucus discharge, and this could be due to the breaking of the mucus plug, the bloody show which seals the cervix throughout the pregnancy. When a woman's amniotic sac or water bag breaks, this is a sign that the baby will be coming out soon. When a water bag breaks, you will experience a gush or a steady trickle of a clear and odorless fluid. This could be slightly tinged with blood. You will have to call your doctor immediately. The real labor contraction may be accompanied by a pain in your back, which will not go away no matter what position you take. When contractions begin to take place within a few minutes interval, this is a sign that real labor has begun.
When you arrive at the hospital, the nurse will check your blood pressure and temperature and place a monitor on your abdomen to check the baby's heart rate and your contractions. The nurse will also perform a pelvic exam, which will determine the dilation and the effacement of your cervix. These assessments will help determine whether you are in active labor. There are 3 stages of labor. The first stage of labor is the longest. There are 3 phases within the first stage. Part 1. Early labor. During the early or latent phase, the cervix dilates to 5 centimeters. The duration of the first phase is the longest, averaging around 8 hours. Part 2. Active labor. Active labor is marked by regular contractions that become longer, stronger, and closer together over time. Part 3. Transition. It is the most difficult phase of labor. The pain may be intense as the cervix stretches and the baby descends into the birth canal. The baby is ready to be born. The second stage labor lasts anywhere from 1 contraction to up to 2 hours. When crying occurs within the next few pushes, the baby is born. The baby will take its first breath and may begin to cry. Immediately after birth, the baby is still connected to the placenta by the umbilical cord. The third stage is the shortest stage, lasting from 5 to 15 minutes.